Hello, my name is Raj Gupta. Welcome. This is the American Society of Regional Anesthesia and Pain Medicine. I am really excited to share with you guys our preview of the ASRA Fall meeting coming up this November in Austin, Texas. I have a wonderful panel of people that have been working tirelessly for years putting this program together, and I know they're excited about seeing it come to fruition in just a couple of months. We want to tell you a lot of little snippets about this meeting that will get you excited, get you motivated to show up and meet some of your colleagues and learn a lot of great stuff. So without much further ado, I do want to bring our panel of experts, enthusiasts, and program chairs onto the stage here. Let me get everybody on here. And Ryan here. Excellent. Let me see if I can get everybody visible. Hey, everyone. How are you? Welcome, and thank you for joining.
Thanks for hosting, Raj.
Thanks, Raj. Happy to be here.
That's always that awkward hello we have to do over Zoom. Who's talking first and who's talking over each other? But thank you guys for being here. I do want to introduce this great meeting that you guys have put together. All of you have been instrumental at assembling the team of people to do this meeting, set up the curriculum, and then all the fun and exciting events as well. So I want to introduce Anuj and Sandy, our program co-chairs for this meeting. Ryan is the lead for the workshops, and then most of you know Dr. Steve Cohen, who's the president of ASRA Pain Medicine, and has kind of inspired the team that put together this fall pain meeting. So Anuj and Sandy, I'm going to start with you guys. Sandy, why don't we start with you? Tell us a little bit about the inspiration for this meeting, kind of what you saw as the need in the pain community right now, and how you guys hope to target that need during this session, this coming up in November.
That is a great question, Raj. So I think one of the things that ASRA is known for and what it excels in is really bringing people from academic and education-oriented backgrounds together, and then kind of the best of the best in terms of the faculty to teach, all people in practice about what are, the changes in terms of best practices and any other new and exciting research that's coming out. For the fellows and other trainees, it's a great way to meet program directors, learn through the trainee track of kind of fellow-specific or resident-specific topics that are not only relevant to their current fellowship, but also how they want to grow and maybe develop a practice when they leave. Lots of great opportunities for learning and basically networking with one another in the academic community and beyond.
It strikes me that in the current world of pain medicine, there's a real need for people. Let's try that again. Can you guys hear me? Yeah, okay.
No.
So I think that there's a real need for the pain medicine community to have collegiality and some sort of way of helping each other, because I think many pain physicians often feel isolated. Anuj, you want to talk a little bit about where the practice of pain medicine comes into play here, both for trainees and for experienced physicians out in the community?
Thanks, Raj. I'm just going to answer this question as a politician, take a little detour and give you a little bit of history. So I was a pain fellow back in 2008 when my fellowship director told me, would you like to go to this meeting in Huntington Beach, California? And I said, oh yeah, what is this meeting about? He said, this is the ASRA fall meeting, which is about regional anesthesia and pain with a focus on pain. So that was my first meeting, and this is now 2025, and this will be my 18th fall meeting. I'm proud to say that over the last 18 years, I have attended most of the regional meetings, the spring meetings, and all of the pain meetings. And the reason I keep on coming back year after year is that I always find I learn so much and I get to meet so many interesting people and go back with so many new ideas. So with this, for this meeting, what Sandy and I thought, and this is to add to what Sandy just mentioned, we were really targeting the entire community of pain healthcare providers. So the theme of this meeting is full spectrum of healthcare, and it has more than one connotation. The first one obviously is that we want all the attending physicians and surgeons, we want the nurse practitioners, the physician assistants, the psychologists, the physical therapists, the researchers, and most importantly, our fellows and residents to be there, because it's said it takes a village to raise a child, and that is very true for pain medicine. The other connotation of our theme is that we are talking about all kinds of pain. We are talking about the short-term pain, so perioperative or trauma-related pain. We are talking about pain that's transitioning to chronic, and we're talking about established chronic pain. And the truth is, I talked about having attended 18 meetings, and you would think that we are way advanced in our understanding, but actually pain medicine is at a crossroads. There are so many doubts about diagnosing pain, what's the best treatment, and there is no better forum to discuss these challenges than to come together in Austin, Texas this year and talk about this together, come up with solutions together. There are some themes that will resonate throughout the meeting. We are going to talk about how to look after yourself as a healthcare provider, and how to develop your career professionally. We are going to talk about some of the newer therapies that are still not insured or covered, so that will feature in the various sessions. And we are going to talk about some of the controversies. There's research which supports certain treatments, and there's research which questions that. So I think the best forum for this is really face-to-face, together in Austin, Texas. So I'm really excited.
That's great. I want to show people that if they're looking to dive into this program, Azra's put together on the website this page that has both a schedule at a glance, but then also the full details. I won't go into the full schedule because it's quite extensive, how many faculty, how many topics, sessions there are. But I encourage people to go on there and find different elements. You can even log in and save different elements. There's an app so you can navigate what your meeting will look like for yourself. I do want to highlight, you mentioned collegiality and the multidisciplinary aspect. One of the things that you guys are putting together on this is be a meeting mentor or become a mentee. Get a mentor for yourself. Talk about how important the mentorship part of this meeting and networking is. Either Sandy or Anuj, if you want to pick up on the mentorship thing.
I'm happy to talk about it. So I think one of the most important pieces of advice I ever received at an ASRA meeting about 10 years ago was go into the meeting and try to meet at least 3 people. And some of those people might end up becoming your mentors, and some of them might become sponsors of feeding projects that you can help with, and ultimately grow your professional network through that pathway, and then produce research and learn how to do high quality research, and those relationships become friendships over time. And so that mentorship basically is an ever evolving process, but it starts with introducing yourself to people. And I think these types of conferences are the perfect venue for that, because you have a lot of well-known faculty that are happy to be mentors, and all you need to do is just approach them and say hello.
Yeah, I've met a lot of people that way that have become, if nothing else, friends, but also colleagues and collaborators in many, many situations. Ryan, I'm going to jump to you here. I think being at a meeting, one of the things that you get that's unique is hands-on workshops. And that's one of the things that ASRA is really known for, is the stellar workshops. You want to mention a couple of those and some unique things that you're doing with workshops?
Absolutely. Similar to Anuj, it's kind of a full circle moment for me as well with the workshops, because one of the first things I did with ASRA when I was a resident, back when I was a CA2 resident, it was my first ASRA meeting ever. And I remember vividly signing up for a cervical RFA workshop when I was a CA2 resident, not knowing what I'm getting myself into, and I've never done a procedure before. And I was amazed by how friendly, collegial the instructor was, and I learned cervical RFA at that session. And obviously I forgot it in the interim before I went to Pain Fellowship. But obviously, I've been to every single ASRA meeting since then until now, but not quite the 19 meetings that Anuj has been to, but certainly every meeting since my residency. And so for me as well, it's a full kind of circle moment, just kind of leading the workshops now, and it's been a very rewarding experience. And to answer your question directly in terms of what I'm most excited about. So number one, we have a lot of new content that we're incorporating into these workshops. So as we all know, interventional pain medicine, rapidly evolving field. There are interventions that are going away, and there's new ones that are coming as more and more emerging evidence comes on. And some of the new content are things like SIJ fusion, basivertebral nerve ablation, and multifidus muscle stimulation. So we're going to be incorporating that content into this meeting. In addition, we also have things like simulation and crisis management, which is very important in the field, which will go over various scenarios that are uncommon but very much needed in terms of learning. And then also some of the other sessions I'm excited about are regenerative medicine workshop as well. So again, just kind of highlighting how much the field has evolved and how much new content we keep on adding to the ASRA pain medicine content. So super excited about that, and hopefully, there a lot of workshops are being rapidly signed on. So definitely, register for the meeting and definitely sign on as soon as possible because space is limited.
Yeah, some of these workshops are really small groups so that people have more hands-on time, and there's not enough space around a workstation to get 10, 15 people in, so the workshops fill up pretty quickly. I don't know if you know much detail about how they're planning on setting this up. I was really curious about this VR hands-on fluoroscopy workshop. That's sort of my interest level, is trying to figure out where augmented reality, virtual reality fits in. Do you know what they're planning on doing with that one?
So for some of the stations, we're kind of doing a virtual kind of thing, meaning that we don't have a cadaver for that workshop. So it's not as flashy as it might seem, but it's going to be a virtual kind of model, and we'll still be able to perform the workshop. But of course, Anuj and Sandy could fill me in if there's additional details on that as well.
Ryan, you're quite right that the idea was not just to replace cadavers, but this is with an eye to the future. We are looking at virtual reality coming into medicine in a big way, and we want people coming to the ASRA meeting to actually have an exposure to this early on. So when this happens in their healthcare system, this is not the first time they've encountered this. So I think this will be quite exciting.
Yeah, I think that this bend towards the future where both in-person meetings could have a virtual component, but then also allow a larger audience to participate in education virtually as the technology, the equipment disseminates to more locations. I think that's exciting to kind of see what is possible in a virtual environment and how close to fidelity you can get using modern virtual reality technology. That's great. Steve, I know one of your passions and motivations during your presidency is to incorporate the military and veterans departments in their education and training for pain medicine into ASRA pain management. I honestly didn't even understand the scale of pain medicine in the military and the Veterans Affairs departments. Talk to me a little bit about what that need is, and then how we want to engage that audience in this meeting.
Sure. Thank you very much. This is very important to me, and I have a son in the military now at Fort Benning, Georgia. So, if you look at the leading causes of medical boards, so basically being forced to leave the military, chronic pain is the leading cause of military medical boards, and it comprises probably 4 or 5 out of the top 10 causes of disability in the VA system. And a lot of the major breakthroughs, particularly for things like post-amputation pain, complex regional pain syndrome, were really developed during times of war. So there's a big need here. And so we will have the first ever, military and VA pain symposium. And there's a lot of exciting events. We're going to provide we're going to showcase the first ever neuromodulation in active duty service members guidelines. We're going to discuss the new sacroiliac joint guidelines. We have the leaders in military and VA pain medicine care. So we have department chairs from the uniformed services of university. We have the Army, Navy, and Air Force pain management consultants to the surgeons general. And we have active and former pain management specialty leaders coming in from Asia and from Europe. We have someone who just spent almost 1 year in Guantanamo Bay 2 years ago, treating not only pain patients, but also psychiatric illnesses among some of the detainees over there. And we have the anesthesia and the pain management specialty leaders for the VA health system, the largest healthcare system in the United States. And exciting, we have some of the leaders in pain medicine from Ukraine who will be coming in and discussing some of the novel treatments for treating pain after traumatic amputations. So I'm really excited about this.
Yeah, I don't think I know of another pain meeting that has really had this in-depth of conversation about this pool of patients and practitioners in the military. And we know historically that many innovations in pain management come from both the VA and the military, many times even on the battlefield. And so I think that we've been sort of maybe a little bit blinded on the need to have them in the conversation. I really thank you for bringing them back in, and hopefully, I think that this will be unique. I don't know if you guys know of anywhere else that's having this much conversation with this audience of practitioners. I think that's going to be really exciting. I know that anytime we're presented with clinical practice in settings that are unfamiliar to us, it sparks my mind to think of problems in new ways. Anuj, one of the things that I always enjoy at these meetings is the interactive sessions. I think that's where, sometimes people are inundated with content that's presented to them didactically. The interactive sessions are really fantastic. And is there any specific one that jumps out to you that you kind of want to highlight? Just for those people who don't know, these are sessions where the focus is not on the slides. The focus is on engaging with the experts and really having a dialogue back and forth.
Thanks, Raj. So we've tried to actually bring in things for the interactive sessions that are usually deficient in people training and practice. So I can personally acknowledge that I was quite poor at physical examination of patients with pain and using my physical examination skills to establish a diagnosis and decide on a treatment plan. So we've actually got some physical examination sessions where we intend to have live models with experienced instructors actually showing people how do you examine somebody with back pain, how do you examine somebody with major joint pain. So I think this will be a great learning experience, and the interactive nature will really allow people to ask questions in a very non-threatening environment. So hopefully they can take some good pointers back to their practice and implement them. The other area I'm quite excited about is something to which Ryan alluded to, advanced treatments and the new treatments that are coming up for pain medicines. So we plan to have some very frank back and forth about the controversies around neuromodulation, some of the newer procedures like basivertebral nerve ablation, and sacroiliac joint fusion, and the procedures like the MILD, which is used in spinal stenosis. And our goal and our hope is that these sessions will have robust discussions. People will not be afraid to ask the difficult questions or the challenging questions. And at the end of the day, everyone goes with not only learning new things for their practice, but also new ideas about what needs further research and what is our duty towards our patients in establishing the evidence base.
That's great. Sandy, you mentioned earlier about trainees, and education obviously is a big component of Azra Pain Medicine, and bringing our fellows up both before they get into fellowship, in their fellowship, and then helping shepherd them into their practice. You guys have created this educational excellence program. It's a whole series of talks, almost as a parallel session. Um, Thoughts on that and where it fits into the larger scheme of what's happening in fellowship training for pain medicine?
Yeah, great question. So that particular part of the schedule is really designed less so for the trainees and more so for the educators. And so
Okay.
it's almost like a master's in best practices for education, all in one day. And so educators, program directors, anyone that really teaches trainees is encouraged to come to this wonderful program that we have, basically learning all the different facets of how do you teach fellows in kind of the changing environment. What should we do about teaching procedures and kind of the influx or the rapid influx of new procedures that are entering the market? How much emphasis needs to be placed on that? You know, how do you troubleshoot different challenges in fellowship education overall? And so it's a wonderful program, and we encourage all educators to please come and learn from the best of the best.
And I think Ryan, you may be the youngest of the group here on the panel. The value of the meeting for fellows to network. Talk about some of the networking opportunities that fellows and trainees can have at this meeting.
Yeah, thanks, Raj. I think, when I kind of alluded to earlier, I attended as a resident, and I feel like we all know there's numerous pain societies out there. I think ASRA is one of the most welcoming to trainees. It's very trainee friendly. We also spoke about the mentorship aspect, and Sandy also mentioned about how it's important to meet as many people as possible. So a lot of my mentors, to this day, that I still am in touch with, I've built those relations early as a resident. In terms of opportunities for residents and fellows, there is a pre-conference workshop for fellows. So that's number one. Number two, there's also events incorporated not only during the actual scientific content of the meeting, but also the fellows meet and greet. That's a very high yield event that I encourage every resident to attend. But also for fellows, especially if you're looking to get a job in another academic practice, for example. There are chairs attending these fellowship meet and greet events, as well as fellowship directors. But I could tell you that when I was a resident, I attended every single fellowship director meet and greet event, and I thought it was very high yield. A lot of the chronic pain fellowship directors do attend these events, and it's a great opportunity to kind of directly network with them, get some advice on fellowship applications, and how to make yourself competitive for fellowship. And then who knows, it might spark even collaborations in terms of mentorship, research projects, and kind of things along that side.
Yeah, a lot of shared information in that environment with both the other fellows, each learning from each other, but like you said, the program directors, super well attended. That room is packed. A lot of excitement, some snacks, some drinks, a lot of real. It's a fun event to be part of, and then you also get this value add to it. I do want to mention that the resident fellow section, the committee that's in Azure Pain Medicine, also a very energetic group of people. They do like a quiz bowl challenge every meeting, I think, and that pool of people has grown, and it has also turned into a mentorship and networking tool for a lot of residents and fellows. Actually, we even have some med students as part of that group as they're kind of leaning towards pain fellowship. So lots of great opportunities for trainees, fellows to be part of this organization, but also get what they need out of their training process and their career progress as well. Steve, this is a good time, I think, to talk a little bit about where pain medicine is within Azra Pain Medicine Society. We're doing a lot for the field. There's a lot of advocacy for pain medicine and practitioners and patients. There's a lot of collaboration with other societies to try to make sure that our voices loud and clear to people who make decisions. You want to mention that and how people can get involved with that during this meeting and then also beyond in the society? Let me take you off mute here. There you go.
Thanks, Raj. So, right, I love this. So we are the largest subspecialty anesthesia organization in North America. I think probably the Western Hemisphere. And we have, arguably the top subspecialty anesthesia journal, certainly the top one devoted to regional anesthesia and pain medicine. And we have a three-part mission. So this is research, and we really sponsor, top research projects. We give away a lot of money for both regional anesthesia and, chronic pain. So we have the Gaston Labat and the Beneker Awards. We have education, and more recently we added advocacy, and we have seats at the AMA, various committees, and we ally with other pain organizations and several surgical organizations as well, like the American Association of Neurological Surgeons, to get a lot of these important bills passed or CPT codes approved. We have over 24 special interest groups, and some of these are really large, and they all have a voice. They publish things in the journal. They create guidelines. They have space in our really highly read newsletter, and they present symposiums. We're asked to present symposiums, even at for other society meetings, and the overarching goal. So where all of these three pillars converge is improving and optimizing patient outcomes for chronic pain. And I really truly believe this. This meeting is fantastic. We are, we have credibility with like federal agencies. We're tasked with putting together now trigger point guidelines. It was just submitted with not only the U.S. Department of Defense and Veterans Affairs, but also the Canadian National Defense. So we're putting together trigger point guidelines. Ryan is helping with that. So we have a lot of credibility, and that's because there's not a lot of spin in society. We have top subject matter experts and telling it like it is. Thanks, Raj.
Yeah, and I think that what people hopefully will see at the meeting is what the impact of this effort has been from the society, its members, its scientists, its advocates, but then also where members can become involved in these projects. Many of you have mentioned Anuj, Sandy, Ryan, all have mentioned have coming to the meeting, but then there is an opportunity to get involved, become part of the conversation, not just listening to the conversation. And that often starts at the meeting. Those connections and mentorships and relationships you make, all of a sudden, Ryan is on one of these guidelines. Anuj is writing these guidelines. Sandy is publishing these guidelines. These are the things that lead to advocacy and change practice. And for those of us who get excited about that stuff, this is a great opportunity for that. So thanks, Steve. I know, again, you've been a champion. You've got all your fingers in the government and advocacy and federal people for a long time, and they listen to you. And so having you at the top of the helm really makes a big impact when you speak and speak with the voice of the whole membership. All right, we're going to wind down.
I wanted to say one other thing. So like Anuj said, it really takes a village. But one of the other small things that I wanted to highlight, since you're bringing up government, is, we were approached by the U.S. Drug Enforcement Agency. And so they're going to have a speaker who's going to discuss really important issues. If you do acute or chronic pain, this is really important, like do's and don'ts of prescribing controlled substances, mitigating risks for patients and prescribers alike. And not only things like opioids, but also relevant issues surrounding like medical marijuana cards,
Yeah.
including those people who are, the implications of medical marijuana mixed with opioids and other controlled substances. So this is a really exciting meeting. I'm looking forward to this. Sorry.
Yeah, no, you don't have to apologize. I think that's great. I mean, I think many practitioners probably struggle with under-prescribing so that they don't put themselves in trouble, or over-prescribing as they're trying to help their patients, and navigating that balance can be quite a challenge. Especially, nobody wants to get in trouble with the DEA, whether intentional or unintentionally. Anuj, let's talk about something fun. Okay, so networking is really important. There's a lot of fun events going on here. One thing I want to start with, and I'm going to let you talk about the other ones, is I think some people finish the session on Saturday and they're heading home, they're trying to get home, and they miss out on our big celebration on Saturday night. And this is always some of my most memorable parts of our ASRA meetings, is that collective get together at Saturday night, sort of this sigh of relief that the meeting is complete. We learned all this stuff, and then you've made all these new relationships. So I highly encourage people to stay for Saturday night and join us for this party. It's a rooftop bar. I think it's going to be a lot of fun. Talk about that, and then some of the other opportunities for networking and socializing.
Thanks, Raj. Well, as you said, this is going to be a rooftop bar, so it's going to be in the open air. We are hoping that there'll be no rain that day. A couple of years back, I think when we were in San Antonio, we had the line dancing event where we had somebody. So we're thinking perhaps we'll replicate that, or maybe we'll do something a little different. So a little bit surprised with people who are coming to this dinner. But as you said, and I would like to emphasize, don't think of leaving the meeting before that dinner, because that's where the real networking happens. When there's a little bit of good food and good drinks around, nothing like that to actually talk to friends, make friends, and talk about the meeting and talk about your plans in the future. So that's obviously the big one. But the theme of networking runs throughout the entire meeting. So on day one, which is Thursday, we have the welcome reception. Day two, Ryan was talking about it, the meet and greet with the Pain Fellows, residents, and the fellowship directors. And then we are also planning to have a few other events that align with the special interest groups that ASRA Pain Medicine has. So I didn't know this until recently, that actually ASRA Pain Medicine has 25 different special interest groups. That's a lot of special interest groups. And there are people doing some excellent work. So we are planning to have networking events for women in regional anesthesia and pain medicine. We are hoping to have one for the regenerative medicine group, which is a very controversial and hot topic in pain medicine. And we also hope to have, some of the other groups like the ultrasound pain medicine group come up with some interactive ideas that allow people to discuss and learn. So I think that's a theme that's going to run throughout the meeting.
That's great. And don't forget the fun run and walk on Friday morning. For those of you who are able to get up that early and exercise, that might be a really great event. Usually the people who go there actually do have a fun time. Usually it's hard for me to wake up that early, but for those of you who can do it, I think you'll really enjoy it. The special interest groups, it's amazing to me when I look at the membership of some of these. They're as big as some of the other small societies out there. Each one, the membership of one special interest group may be as big as another society in itself. And we have 25 of these within this organization. Great opportunity for people to show off what they're capable of and elevate themselves within the organization. So I encourage people to join, but then also become an active participant, come and see what some of these sessions are. Well, as we wrap up here, I want to emphasize a couple little deadlines and dates. Early bird deadline, September 18th. September 18th means you can save money. If you register for the meeting before September 18th, you save money on the meeting. That's always a great thing to do. You can still register for the meeting right up to the day of the meeting, but we'd really love to see you guys register and sign up early, start making your plans, sign up for the workshops, and start filling out your meeting app with all the events that you're planning on going to, the talks that you're going to. The second part of it is the hotel is fantastic. We have a room block at the hotel. It's discounted for the meeting. That deadline is October 17th. After that, you may have to find a hotel nearby, or we may not be able to get you the really good rate that ASRA has negotiated. So register for the meeting, sign up for your hotel, get that in early, save some money, and then start making your plans. And then on social media, we're going to be following hashtag ASRAFall25. Follow that, post to that, tell us what you're excited about during the meeting. We'd love to see your input on what the society is bringing to the table and where we need to move into the future. I think all of us are interested. So go to asra.com/pain. You're going to find all the information about the meeting there, the deadlines, the registration links, the full program, and all the wonderful faculty that are going to be participating. Did I miss anything? Anuj, Sandy, Steve, Ryan, is there anything I missed about this meeting? I'm psyched about it. I'm going to be there. All of you guys are going to be there. I look forward to meeting everybody there.
I'm psyched about it also, Raj. I mean, this is great.
Yes,
well, thank you all.
Excited to see everyone. So please come up, say hi. We'll see you soon. I will say the hotel is amazing, so make sure you get your booking in early. You'll definitely want to stay at that JW Marriott. It has an outdoor pool.
And it's Texas in November. It's going to be gorgeous, I'm sure.
Yeah, exactly.
Yeah. Well, thank you all. This has been really fun. And, the more I look at the program, the more I'm trying to figure out how to navigate all the different things that I want to attend. I don't even do chronic pain medicine as my practice, but I feel like I learned so much when I go to this meeting, and lots of ways to incorporate into my own practice at work. Thank you all. And I will see you in November.
Thank you.
All right, thanks.
All right.